Alrighty, so we're ready to start. Welcome. Thank you for joining us today for our first Lunch and Learn. I know it's noontime. We don't have lunch for you guys. I apologize. We just call it Lunch and Learn because it's noontime. So we're going to be talking about an important topic, which is cervical health. Just to give you some information, cervical cancer is the third most common cancer women suffer worldwide, causing about more than 270,000 deaths annually. So it's an important topic that we want to discuss as your primary care provider. My name is Karen. I'm one of the community outreach specialists at Friend Health, and I will be talking about Friend Health and our services before Dr. Loberg talks about cervical health. Next slide, please. So that's the agenda. So welcome, it's me, Karen Jimenez. Dr. Loberg will talk about cervical health awareness and some information. We're gonna have a session for question and answer, and then we'll have our closing remarks. Next slide. So we are Friend Health. We are a federally qualified health center here in the south side of Chicago. We provide a wide range of services for our patients. If you are a patient, welcome. Thank you for joining us in. If you are a new patient, you'll get some information about our services. So we are primary care providers. So some of the services that we offer is adult medicine, pediatrics, gynecologists. We also have behavioral health, infectious disease, psychiatry, dental services. We also have other health-related services and programs such as care coordination, social services. We also have health insurance enrollment assistance, legal assistance, laboratory services. So we have all kinds of services, and all patients are welcome at Friend Health regardless of their ability to pay. As I mentioned before, we have 7 locations in the south side of Chicago. Our main clinic is the one in 800 East 55th Street, and I'm the outreach worker for our Pulaski and Ashland Clinic. If you could go to the next one, please. So let's talk about our dental services. So we are pleased to announce that we are offering dental services at our Western and Pulaski locations. So if you are a new patient, you don't have to receive services just for dental, or you don't have to receive primary care services to receive dental services. If you just want to come in for dental, you can, or if you want to come in for primary, you can, but we are offering those services for our patients. And some of the things that we offer is annual exams, x-rays, cleanings, fluoride treatment, sealants, and we see adults and children at Pulaski Clinic and our Western Clinic. Could you go to the next slide, please? So Friend Health has an integrative healthcare setting, meaning that when you come in to receive your services for your primary care provider, you can also receive mental health and substance abuse counseling all in one. And so we like one stop when you come in to see your doctor. You don't have to receive the other services, but if you are here, you're more than welcome. If you are eligible for those services, you can receive them. So let's meet the team. So Dr. Liz Amarillo, she is our behavioral health director, and she is located at our Cottage Grove location. That's 800 East 55th Street. And she has a team of behavioral health consultants that cover all sites. So when you come into the clinic, you can receive behavioral health services in any of our locations. Next slide, please. So what happens when you get referred to see a behavioral health consultant? Sometimes your provider may do an initial assessment, and if they might see that you qualify for the benefits, then they might refer you to see a behavioral health consultant. So what do? They are very knowledgeable in providing assessments, and they can give you any treatment, intervention. They can also provide referrals and recommendations. So aside with providing behavioral health services, counseling, therapy, we also provide psychiatry services, and our psychiatry services are mainly, they are telehealth, and it's usually located at our main clinic, 800 East 55th Street. But so if you're interested in those services, you could always let your provider know so they can do the referral for you. Next slide, please. So we're gonna talk about HRDI. HRDI is a subsidiary of Friend Health, their programs and services. So HRDI, they have an intake department location. So their main location for them is 200 East 115th Street, and that is their main site. That site is 24 hours open, 7 days a week. Could you go to the next slide, please? So since HRDI is a subsidiary of Friend Health, our services expanded. So our patients are able to receive additional benefits aside from counseling or therapy. So HRDI is a community behavioral health center that provides a array of prevention, intervention, and treatment health services that address various mental health, substance abuse, and community health concerns. HRDI was established back in 1974 in the south side of Chicago, and they have been providing support to underserved communities. HRDI also has 13 additional programs and services, and they are addressing but not limited to presenting any of the issues regarding sadness, anxiety, substance abuse, misuse. They also provide school behavior concerns, any social, emotional concerns that you may have. They also have medication management, crisis assessment, etc. Next slide, please. So they also have a school-based interventions they can provide. HRDI has a wide range of services as well, where they can provide crisis assessment at our Jackson Park Hospital, St. Bernard, and of course the Roseland Triage Center. So let's say you are in need of get an assessment for yourself or a loved one, you could always go in any of those locations. HRDI also has residential treatment and residential group living setting. They have opioid treatment. They also have case management, parenting assessment, and they also can provide any housing support. And if you or a loved one are in need of any help regarding those services, you could always call this number. The number is 312-441-9009. Next slide, please. So HRDI has different locations. So as I mentioned before, the main intake department location is the Roseland Community Triage Center. That's on 200 East 115th Street. Let's say you are in need of services and you walked in of any of the other locations, there's no problem. They could always guide you to the right department or where you can get the initial assessment, and they'll give you those services that you're in need. So as you can see, a lot of them have different locations. They do different things at each site, but if you call the number or you go to the main clinic or location, they could always refer you to the right place. Next slide, please. So insurance accepted and benefits assistance. So all patients are welcome at Friend Health, regardless of their ability to pay. We accept Medicaid plans. We accept Medicare, commercial insurance. In case you don't have health insurance, Friend Health offers a sliding scale fee program, and it's based on your household size and income. So let's say you don't have health insurance, but you are in need to see your medical provider, you could always apply for the sliding scale fee. And the things that you will need, it's your photo ID, proof of income, and your proof of address. Next one, please. So again, my name is Karen Jimenez. I'm one of the community outreach specialists. My information is listed there. In case you guys have any questions regarding the services that we offer or are in need of scheduling an appointment, you can contact me or any of my teammates, which is Conrad Gilbert and James Corbett. Okay, so before we go into the next, let me introduce Dr. Loberg. Dr. Loberg is, she's a OBGYN doctor at Friend Health. She earned her degree from the University of Chicago, Pritzker School of Medicine. She completed her residency at the University of Chicago Medical Center, and where she received the award as a resident teacher. Currently, Dr. Loberg is our OBGYN medical director, and she continues to excel as one of our providers. So without further ado, here's Dr. Loberg.
Thank you so much, Ms. Jimenez. I'm so excited to be talking to you guys today. I wish we were all in person, and I totally wish we had lunch. But either way, I'm happy to be talking to you guys about cervical cancer prevention because it's something I feel really passionate about, and it's also something I am really optimistic about. There's some developments in cervical cancer prevention that I think will change our lives, people on this call, and will certainly change the lives of our children and the next generation. Go ahead, next slide. So here's what I'm saying. Cervical cancer is 100% preventable. There's a lot of things we cannot control in this world, and there are a lot of cancers that we really can't change our risk about. But cervical cancer is not one of them. It is 100% preventable. But sadly, we still have 10,000 new cases of cervical cancer every year. Go ahead, next slide. What is cervical cancer? The cervix, as you can see from this picture, is sort of like the very bottom part of the uterus. People hear about their cervix during childbirth. Your cervix has to dilate. It's the part that stays really closed until you're having a baby and then opens up to allow a baby out. Okay, so it's the bottom part of the uterus. And cervical cancer, like any cancer, is when normal cells that have a job, the cervix has a job, it's supposed to open and close, it's supposed to stay closed when it's supposed to. Those cells, instead of doing their regular job, become abnormal. And they believe that their job is just to reproduce a lot. So instead of sitting there and doing their regular job, they just make copies of themselves over and over and over again. And that's why you hear, when people have cancers, that they have tumors, because one cell gets a message to grow. And so you can see from this slide here, you may get one or a few abnormal cells. And then if they're allowed to hang out there for a while, they'll just reproduce and make a million billion babies, and they can grow into a tumor. Okay, so that's what we're looking for with cervical cancer. Next slide. Why do people get cervical cancer? So, we know what causes certain cancers, like people get skin cancer if they're exposed to lots of sun or they don't wear sun protection. Some people get lung cancer because of smoking or other exposures to things that are toxic to their lungs. Some people get certain types of cancers because they can run in the family. It's caused by their genetics. Cervical cancer is a cancer that is caused by a virus. This isn't typical for most cancers, but it is true for cervical cancer. The virus is called human papillomavirus, or you may have heard of it called HPV. It's a virus very much like the cold virus, the flu virus, the coronavirus. And most viruses can be attacked by your own immune system. And that's true with human papillomavirus. So the human papillomavirus is a virus that likes to hang out on the cervix, which is the bottom of the uterus. It also likes to live inside the mouth. It likes to live on those soft, moist membranes like you have in your mouth or inside the vagina. There are tons of types of HPV, okay? HPV is so common, and there's over 150 subtypes, just like the cold. You can get a cold one winter, and you'll develop immunity to it. And then you can get another cold later that same year or next year, because there are so many different types. Same with human papillomavirus. It's really common. We're going to find it everywhere, and there are lots of different kinds. Next slide. Who can get it? Everyone. So women know about this because they have a cervix and they're worried about getting their pap smears every year to screen for cervical cancer. But the truth is that women can get HPV in their cervix. But I also told you that HPV likes to live in the mouth. Men can carry HPV and they're never tested for it. We don't have a test for HPV for men. So they may be carriers, but they won't know. And even the men who would love to know and find out, it's not routinely screened for, so they're not going to know. So men, women, obviously all types of men and women, older, younger, all different races. It affects everyone. Like I said, HPV is incredibly common. People, it can be frustrating or scary or embarrassing to find out that you have HPV. But the real truth is that 80% or more of people are going to have HPV in their lifetime. And so if you have HPV, you are an excellent company. It's almost every single person. And so you may be shocked by that number. 80% of people are going to have HPV. Are they all going to get cancer? Um, no, they're not. Okay. Because, like I said, there's a lot of types of HPV and there's a lot of ways that we can avoid it. Go ahead, next slide. How do people get it? I told you where it likes to live. It likes to live in the mouth, it likes to live in the vagina or on like slippery membranes. And you guessed it, people get it from contact with those surfaces: vaginal sex, oral sex, anal sex. And like I said, 80% of people are going to get it. So we usually think of it more as a marker of sexual activity or a marker of sexual adulthood. Once people become sexually active, they're going to be exposed to HPV. Can I avoid it? We talk about condom use for protecting against other types of viruses that live on those surfaces and can be sexually transmitted, but condoms are not super effective at preventing HPV because it lives generally on the surfaces. Okay, so no matter what, if you become sexually active, which my hope is for every adult, they get to, they're going to have a chance of being exposed to HPV, and most of them, 80% or more, are going to be exposed to HPV. Okay, a fact of sexual adult life. However, that bottom line on there, I wish I could point. Most people are going to clear the virus on their own. You have a strong, healthy immune system that's in there fighting off viruses for you all day, right? It's fighting cold viruses, it's fighting everything else. Your immune system is in there kicking virus butt all day long. And so most people, 90% of all those people who are exposed to it, are going to get rid of it on their own. It's just going to go away. Okay. So people are like, oh my God, I'm going to get it. And I'm like, probably, but you're also probably going to get rid of it all by yourself. Okay. Next slide. What else does HPV do? I told you it lives in all these places. We know it can cause, it likes to live on the cervix. I'm talking about it because, spoiler, it can cause cervical cancer, but it can also do a bunch of other things as well. The other main thing that women and my patients are watching out for is that HPV can cause warts. Warts are not cancer, but they are uncomfortable or embarrassing or not attractive. We have lots of treatments for warts if they are cropping up and bothering your life. They can be removed. They can be removed in lots of different methods. But if you can avoid them, that would be great. What else does HPV cause? It can cause cancer for men. Like I said, we don't test for HPV in men, but it can cause cancer of the penis, which is extremely rare, the rectum, rare too, but much more commonly, if you're looking at those numbers, it can cause cancer in your mouth. You may have been wondering, like, oh, Ms. Jimenez is telling us all about dentistry. It's one of the ways that we can screen ourselves for cancer of the mouth, okay? So men are at risk from HPV, cancer in their mouth, and if you look at those numbers, they get cancer in their mouth from HPV about as much as women get cancer of the cervix from HPV. So men and women are in this together, okay? We both are at risk from HPV, and we are both equally at risk of getting cancers, either of the mouth or of the cervix for women, that are painful or disfiguring and scary, okay? So we're all in this together. All right, next slide. Unfortunately, and this is something that we don't really understand perfectly, men are getting more and more cancers in their mouth because of HPV, okay? And I know we got a lot of women on this call because I thought we were just going to talk about cervix, but men are suffering more frequently from HPV cancers than they were in the past. And so we in the medical community are really working on making sure men are educated, screening more frequently for HPV cancers, and ultimately protecting ourselves from HPV. Next slide. So what are we going to do? I've just scared you half to high heaven about HPV. So I said it's unavoidable, right? We're all gonna, if you grow up and become a sexually mature person, which I hope we all get to do, you're gonna come in contact with HPV. How are we gonna protect ourselves, our male partners, our female partners, our children? What are we gonna do about this? Next slide. We have an incredibly successful tool at protecting ourselves from HPV and all the potential cancers and warts that they can cause. We have an HPV vaccine that protects you against the 9 most aggressive types of HPV, both the ones that cause warts and the ones that cause cancer. Okay, next slide. There's lots of reasons to get the HPV vaccine. So I know many of us in this room have children. The vast majority of the time we give this vaccine to children starting age 11, but people can get the vaccine up to age 45. The main reason to get the HPV vaccine is to protect yourself from cervical cancer or head and neck cancer or warts. We know that HPV is common, so just wearing condoms and being super safe or only having 1 or 2 partners isn't really enough. HPV is too common for that, and it finds its way around condoms. So even if your plan is to use condoms all the time and only have 1 partner, you still are at risk, unfortunately, from HPV. So there's no avoiding it any other way besides the vaccine, unless you're going to stay not sexually active for your entire life. The vaccination works incredibly well. In places where we have high vaccination rates, cancer is dropping fast. It's 98% effective at blocking the types of HPV that cause cancer and warts. We've already seen lots of cancer drops. The number 4, preventing cancer is better than treating cancer. I mean, this seems like a no-brainer. Preventing cancer in this case involves getting a shot. And unfortunately, cervical cancer treatment is difficult, often painful, involving surgery and chemotherapy. And we're not as successful at it. We have treatments, but often there are people who unfortunately are not able to be cured of that cancer. All right, next slide. Who can get vaccinated? So we're lucky the vaccine is approved for people starting at age 11. Younger people are luckier. They only have to get 2 shots. And that's because their immune system is just stronger than an older immune system. It's like, you can't teach an old dog new tricks. Well, you can, it just takes 3 shots instead of 2 shots. It takes a little extra effort for an old immune system to learn new tricks. So younger people can get 2 shots to become immune to HPV. And older people up to age, it says 26, but just 2 years ago, they approved it up to age 45. So men and women, boys and girls from 11 to 45 can be vaccinated to protect themselves from HPV. Next slide. So people worry about, any medical treatment. What are the side effects? So I've told you a lot about how it's going to help you. It's going to prevent warts. It's going to prevent cancer. It's amazing. Is it safe? In the US alone, we've given out over 100 million doses, and there are no severe side effects to this vaccine. Across the world, we've given out multiple hundreds of millions of doses, and we have not seen any side effects from this vaccine. And we have seen a big drop in HPV in populations that are vaccinated. Next slide. What else can we do? We thought I was just going to talk about pap smears, but I snuck in all this talk about HPV. Even people who are vaccinated, even people who aren't vaccinated need to get an annual pelvic exam, right? Somebody has to look at your cervix, somebody has to look in the vagina, they have to do an exam. It's hard to see down there. You need a specialist to be looking to see if there's anything abnormal looking on your cervix, abnormal looking in the vagina, and to help you know if you need a pap smear. These rules about who needs a pap smear change all the time. I don't expect my patients to know when they need a pap smear and when they don't. It's complicated. That's the short answer. So you need to go to your gynecologist and talk about your past, the medications you take, your medical problems, any surgeries you might have, and they're going to help you know if you need a pap smear, because your sister might need one or your aunt might need one, but you might not, or you might even when other women don't. Okay. Symptoms are hard. People are like, what symptoms does HPV cause? Mostly nothing. Okay, mostly people with HPV infections have no symptoms at all. They can never tell if they have HPV unless their doctor goes and looks. Cervical cancer might have some symptoms. People might see abnormal bleeding. They might find abnormal discharge. They might even have pain. Those symptoms you need to bring to your gynecologist right away. One thing that people never think about when they're thinking about cervical cancer prevention is going to the dentist. These things are on opposite sides of our bodies. What do they have to do with each other? HPV wants to live in your mouth just as much and can cause the same problems on the cervix inside the mouth and throat. okay? And our dentists can look inside the mouth, can look on your gums and under your tongue in places where, again, hard to see places, and tell you if you're at risk for HPV cancers in your mouth. And this is true for your male partners too. I know everybody is not excited about going to the dentist, but these quick visits can help save your life. And lastly, become an advocate. This isn't for everybody, but a lot of people are nervous about talking about their reproductive life, their reproductive organs. These are not easy topics. These are not easy topics for young people to ask questions about. A lot of people are nervous about going to the gynecologist. What's the experience going to be like? People are nervous about getting a vaccine. And so if you feel comfortable being somebody who can broach those topics with young people, um, tell them that their youth is the time when they can start protecting their health for the rest of their life by seeing a gynecologist, by asking questions about their sex life, their reproductive life. What's a uterus? What's a cervix? How are they all connected? Then you can be somebody in that person's life that can help them protect their health in the future. Because, like I said, cervical cancer is 100% preventable, and particularly for younger people who are able to get vaccinated before they're exposed to HPV. Next slide. The main thing here is preventing cancer is better than treating it. When we can detect HPV early, we can increase your screening. When we can detect abnormal cells early, we can prevent cancer. And when we can get a vaccine into somebody before they're sexually active, we can protect them from HPV for their entire life. Next slide. All right, I've said it all about pap smears and HPV. If anybody wants to put some questions in the chat, I'm not sure how you guys want to do it. I'm happy that we're recording this so that we can share it with people in the future.
I would say if you have any questions, just type in on the chat will be better. Thank you.
I know that was a lot of information very, very quickly. One of the things that some people worry about, and this is true about the dentist and the gynecologist, people are like, well, I haven't been in years. It only takes one visit to be totally caught up. People put it off for a long time and they get nervous that process of going back is going to be a little bit extra. With one pap smear and one physical exam, you're all caught up, like all the years of not going.
Also have that raise hand function.
That's true.
Yeah, some people know how to use the raise hand function, some don't.
I got a question about HPV vaccine starting at 9. It's true. It can start that young. A lot of people, so there's a vaccine schedule that a lot of the pediatricians try and keep them on, and they group the vaccines together in kind of a bundle. The 11 and 12-year-olds are going to be getting their Tdap and another vaccine at the same time, I believe. I don't see a lot of kids for their vaccine schedules. So that's often when these vaccines will be given in a group together, so that you can get them as efficiently as possible. But it can be given that. What forms of insurance do we take? My belief is all of them and the sliding scale. Is that true, Ms. Jimenez?
Yes, that is true. We take all of them, majority of them. If not, we do have our sliding scale fee program. And if you have any questions, you could always contact me. I'll put my number in the chat.
There was a question in there about people over 45, 46 and older people. The vaccine is not FDA approved for people over 46. And so I don't think that there will be access to it over then. That's when you want to focus on making sure that you are maintaining your screening the best you can, and make sure you've got any of your high risk conditions that your gynecologist might be aware of. One of the other conditions that puts you at higher risk for cervical cancer that I didn't bring up is smoking. I know these things seem all over the map, but smoking can increase your risk of cervical cancer. And the reason it does that is it can be hard on your immune system. And so people who have HPV and are in increased screening for cervical cancer but smoke, I really encourage them to quit smoking, because that is one of the things they can control. Even if they're not able to get the vaccine, we try to focus on stuff we have control over, and cutting back or quitting smoking can help lower your risk of cervical cancer.
Kind of wanted me to make a clarification of the health insurances. We do accept Medicaid, Medicare, most private insurances that have PPO. We do accept some HMOs, not all of them, but you could always contact me or the main clinic for insurance questions. Any other questions?
I know that during COVID times, a lot of people haven't been, I'm glad we can do this over the Zoom, but a lot of people have been putting off some of their personal maintenance, their pap smears, their mammograms, their colonoscopies, their regular visits to the dentist, et cetera. We are up and running and ready to help you catch up on anything that may have, that you may have fallen behind on in the last year.
And we have 2 questions in the chat box, Dr. Oberg.
All right, let me take a peek. How should we approach our partners if we find out we have HPV? That is a great question, and we address it all the time. So this is difficult, okay? Because yes, this is an infection that can be passed through sexual contact. And so I recommend talking about it with your partners. It's difficult because men don't get the same background training. They don't see a doctor who may have ever talked to them about this in the past. I'm happy to see both partners, and I have in the past, to talk about what HPV means for them as a couple. I encourage people to educate their partners about how common this virus is, how likely they are to clear it, what effect it might have on men, meaning the best thing a man can do for himself is go get an annual dental visit, because that's their greatest risk, and to get vaccinated themselves. They may be able to clear the virus, and a couple, even who have the virus sort of together as a couple, may be able to clear the virus together, but it can be difficult. One partner may clear the virus, and then they kind of pass it back and forth from time to time. So the best thing to do is, knowing that this may be affecting you, to get the appropriate screening that you can. But also, a lot of doctors, including myself as a gynecologist, I'm happy to counsel both members of a relationship about how a sexually transmitted infection or something like HPV might affect them personally. Let me look back at the chat. What happens if someone is diagnosed with cervical cancer? So, we didn't talk much down the line, but so we start our process with screening with pap smears, okay? Pap smears allow us to look at the cells of the cervix under a microscope. That's what we're doing. We take a paintbrush and we brush some of the cells off the cervix, and we look at them under a microscope. And we also test them for the HPV virus. If we see abnormal cells under the microscope when we do your pap smear, we will do a follow-up test where we actually take a microscope outside and zoom really closely up on the cervix so that we can see if there's any areas that look more abnormal that we couldn't see with our naked eye. And then we will target biopsies to those areas. With those biopsies, we may find some mildly abnormal cells, and we want to watch them more closely. We may find precancerous abnormal cells that we want to treat with milder treatments, or unfortunately, sometimes we find cancer. For women who are diagnosed with cervical cancer, they need to see a specialist, an oncologist, that's a doctor that specializes in cancer, and have their treatment planned for them personally. It often includes surgery. It can include radiation, and it can include chemotherapy. And that will be different depending upon some of the factors of their cancer that will have to be individualized. And that's something that we can help if I diagnose a cancer in my clinic, unfortunately, for one of my patients, I will make sure they get to the right specialist so that their treatment can be coordinated. So people are like, oh, I've had another question here is, I've had an abnormal pap smear, I've already had HPV. Is it too late for me to get the vaccine? Not at all. Like I said, there are many types of HPV, and the vaccine can protect you against different types. So just because you've had one type of HPV, it does not mean that you can't benefit from protection against the other types. Or you may clear that, and your body will have developed immunity to that virus while it was cleared. So there's absolutely no reason not to get the vaccine just because you may have had an abnormal pap smear in the past, or even had HPV in the past. I still highly recommend getting the vaccine. That's a great question. A question about using Blue Cross Blue Shield insurance. I definitely see many patients with Blue Cross Blue Shield.
Yes, we do accept Blue Cross Blue Shield. That depends on what type of Blue Cross Blue Shield you have, but I want to say we do accept it. So we are almost at the end of the session. Do you guys have any one last question that Dr. Lober can answer? If not, then I think we're ready to kind of end the lunch and lunch in a few minutes. Yeah.
The last question, there's two questions. One is on 63rd Street. The HPV vaccine is available at all of our clinical locations, and there are gynecologists at all of our clinical locations who can help you decide if you need a pap smear, who can give you a vaccine. This is all something that's available at every single one of our sites. Does the vaccine give immunity to HPV and for how long? It is very effective, meaning it's 98% effective at protecting you against cervical cancer and those HPV types. It protects you against 9 HPV types. I mentioned that there are over 150 HPV types. The vaccine is designed to protect you against the ones we know are most aggressive at causing cancer or causing warts. And yes, it can provide you immunity to those 9. Some people may still test positive for HPV, but we know that HPV is probably much less likely to cause problems like cancer or warts. So even if you end up getting one of those, milder types, you're more likely to clear it. It's less likely to cause cancer. Overall, it's still protected you from what we really worry about, which is the cancer that it could cause. I appreciate you guys all coming out. Oh wait, I haven't had a pap smear in years. It's important to share this with your gynecologist. Absolutely. Gynecologists, one of the benefits of our job is we get to have real talk with people. Your gynecologist is the least shy person you know. They're the person that you can tell all of the things to. They're going to keep your secrets, and they are going to be non-judgmental about getting your healthcare, your sex life, things that you may have let lapse and are embarrassed about. We are not shy. That's why we went into this profession, because it's a whole lot of fun. And we want to hear you share the things that you're not able to share with other people with us, so that we can help keep you as healthy as we can, as long as you can. So no worries about that. Tell us the truth.
Alrighty, so I think we want to thank Dr. Lober. Thank you for all this information. It is a lot, I know, but it is, like you mentioned, it's 100% preventable. So if you are a patient over a clinic, if you have not gotten your annual exam, make sure you can schedule it and see Dr. Lober. If you want to see her, she is very informative, and like you said, you're not shy, so that's good that they could be comfortable around you. Here are the number listed, so that's our main number. Also, like she said, you can schedule your annual exam or get your dental annual exam. We can see you at any of our locations. Thank you again, Dr. Lober.
Thank you so much for organizing this, and for all you guys for coming out and participating with your excellent questions.